Breaking news, major changes coming to Australia's pension and aged care systems starting July 1, 2025. Australia is entering a transformative phase as sweeping changes to the nation's pension and aged care systems are set to take effect from July 1, 2025. These changes aim to address the evolving needs of older Australians by increasing financial support, enhancing healthcare access, improving aged care services, and encouraging more sustainable retirement savings through superannuation reforms. With a rapidly aging population and rising costs of living, these updates are considered among the most significant reforms to date. Starting with the age pension, eligible Australians will see their payments increase substantially. For singles, the fortnightly pension will rise to $13, while couples will receive a combined payment of $1,950. This adjustment comes in response to sustained inflation and cost pressures that have significantly impacted older Australians, particularly in essential areas such as healthcare, groceries, energy bills, rent, and home maintenance. The goal is to improve the quality of life for retirees who rely heavily on the pension as their main source of income. In addition to payment increases, the government is reforming the asset test thresholds that determine pension eligibility. For homeowners, the asset thresholds are increasing by $50,000 for singles and $75,000 for couples. Non-homeowners will benefit from a $100,000 increase regardless of marital status. These thresholds are used to assess whether a person has too many assets to qualify for a full or part pension. The current taper rate, which reduces the pension by $3 for every $1,000 over the threshold, will be adjusted to $2.75. This means pensioners can retain more of their payment even as their asset levels grow modestly, creating a stronger incentive to save and invest during retirement without fear of being penalized. Another important change affects the deeming rates, which estimate the income generated from financial assets like savings, shares, and investments. These deeming rates are used to calculate the income for Centrelink assessments and have not been updated in several years, despite fluctuations in interest rates. From July 1, 2025, the lower deeming rate will be reduced from 0.25% to 0.2% for singles with assets up to $60,000 and couples with assets up to $100,000. The upper deeming rate will be reduced from 2.25% to 2.0%. This adjustment acknowledges the persistently low returns on savings in recent years and is designed to prevent unfair assessments of pensioners' financial positions based on unrealistic earnings projections. The Commonwealth Seniors Health Card will also be expanded to include more self-funded retirees. The income threshold for singles will increase to $98,000 and for couples to $156,800. Furthermore, superannuation income streams that were previously counted toward the income test will be partially excluded, allowing more retirees to qualify for the card. The CSHC provides significant savings on prescription medications, medical consultations, and energy rebates, and the expansion of eligibility could benefit over 44,000 additional retirees, many of whom previously just missed out. On the aged care front, the government is launching a new support-at-home program to replace the existing home care packages. This streamlined program will provide flexible services tailored to individual needs, allowing older Australians to remain in their homes for longer with improved access to nursing care, mobility aids, home maintenance, and social support. All current home care recipients will transition into the new system, with the government promising no one will be worse off under the new arrangement. Contribution amounts will be aligned with existing income and asset assessments, creating a fairer and more transparent funding structure for users and providers alike. Reforms are also being introduced to residential aged care. All residents will continue to pay a basic daily fee, which covers meals, cleaning, and other everyday services. However, a new hotelling supplement will require wealthier residents to contribute more toward accommodation and hospitality services. In addition, a new non-clinical care contribution will be introduced, covering services such as physiotherapy, personal care, and daily activities. This contribution will be means-tested, and a lifetime cap of $130,000 or a maximum contribution period of 4 years, whichever comes first, will ensure costs remain manageable. These measures are part of a broader effort to make aged care funding more equitable while ensuring the sustainability of services for future generations. Superannuation reforms are also central to the July 2025 updates. The superannuation guarantee, the percentage of earnings that employers must contribute to employee superannuation accounts, will increase to 12%. This change continues the government's long-term strategy to build adequate retirement savings for all Australians. Increasing the SG rate ensures that workers retire with greater financial security, especially those in low to middle income brackets. A new tax on high super balances will also be introduced. Individuals with total superannuation balances exceeding $3 million will face an additional 15% tax on the earnings above that threshold. The government argues that this measure promotes fairness in the super system and discourages the use of superannuation as a tax shelter for the wealthy. The additional tax is expected to impact fewer than 0.5% of account holders while helping to rebalance the superannuation system in favour of average working Australians. Superannuation will also be paid on government-funded paid parental leave for parents of babies born or adopted from July 1, 2025. Payments will be made annually starting July 2026. This is a major shift in super policy that aims to reduce the retirement savings gap between men and women, as women are disproportionately affected by career breaks to raise children. Including super contributions in parental leave entitlements recognizes caregiving as an essential part of society and supports gender equality in retirement outcomes. Another important change is the introduction of Payday Super, which will come into effect from July 1, 2026. Under this rule, employers must pay superannuation at the same time as wages rather than quarterly. This change is expected to improve compliance, reduce instances of unpaid super, and allow employees to track their super more effectively. The new system is particularly beneficial for casual, part-time, and younger workers, who are more vulnerable to missing out on super payments under the current system. Finally, the government will freeze the Pharmaceutical Benefits Scheme, PBS, co-payment for 5 years to protect pensioners and concession cardholders from rising prescription costs. The co-payment will remain at $7.70 for eligible groups, helping older Australians manage essential medical expenses more effectively. This move comes in response to mounting pressure from advocacy groups and healthcare providers concerned about affordability and medication adherence among the elderly. In total, these policy shifts represent a significant investment in the well-being of older Australians and a rebalancing of the retirement income system to be more fair, sustainable, and inclusive. The changes touch nearly every aspect of retirement and aged care: income support, healthcare access, home care services, residential care, and superannuation. They are designed not only to address immediate cost of living concerns but also to prepare the country for the demographic challenges ahead as the population continues to age. With longer life expectancies, increased demand for services, and shifting workforce patterns, these updates are both timely and necessary. Australians approaching retirement are encouraged to review their eligibility for the new pension thresholds, healthcare entitlements, and superannuation contributions to ensure they maximise the benefits available under the updated rules. Financial advisors and Centrelink officers are expected to provide additional support and information to guide retirees through the transition. It is critical that all affected individuals understand how these changes impact their financial planning, healthcare choices, and aged care options in the coming months. Subscribe for more updates on pensions, superannuation, and support services.